directly below the operating theatre, so I'm sort of 30 seconds away from the entrance to the theatre. Sit down, have some lunch depending on the time of day it is. Get outside, walk around, get some fresh air because you're going to be there for a few hours. But the time passes fairly quickly. And second time round it passes even quicker because I think you've got the confidence to know what's going to happen and you know how things are going to be. And this time round I saw Mr McNamara walk past the corridor, so I knew that surgery had finished, so I made my way back up the stairs and just kind of hung around outside the theatre entrance and then just waited for someone else to walk past that I recognised, and then that got me into the recovery room.
We keep the patient for approximately 4 days after the operation, but after that, support from the family, support from the school, support from the home environment and the physiotherapists in the community is absolutely essential in allowing these patients to fully rehabilitate. As you can see beforehand, the knee was very unstable, the kneecap was dislocating on its own, and when we finished the operation the kneecap was nice and stable. So he's just in recovery and he'll get brought round to the ward, and then we'll meet him again there.
Yesterday, I remember the time leading up to going to getting my anaesthetic, but as soon as you're in the room and you've had the anaesthetic, there's nothing you can remember. So a good 4 or 5 hours later, you get a lot of sleep from that, which helps because the first night's probably the most difficult to sleep on because it's your first time on the new machine, and it's always just a bit, you're coming off your anaesthetic, the drugs are starting to wear off from the surgery, so it's a bit harder on the first night.
And the swelling settling down?
Yeah, it's started to go down now, yeah.
How's your pain?
I've not had any pain since I've had the PCO.
Good, fine. So James is now 2 days post-op. He's progressing really nicely. The advantage that he has is that he's had the other side done, which means that he knows what's going on, as you heard. And really the plan is just to increase his range of movement, and then we're just going to carry on with working with the physiotherapist to improve the bend in his knee, allow the swelling to go down. We're going to do some x-rays to make sure that everything's in the right place, and then just carry on controlling his pain whilst we allow him to rehabilitate.
So I'm James's mum and been here now for a second time. The first time that he had his knee surgery, which was about 7 months ago, we came down because we don't live locally, so we came down the night before and we stayed in accommodation, which meant that he had a better night's sleep going into the morning of the surgery, and it was at 7 AM that he had to come into hospital, so he just had a bit more sleep to prepare for that. So we came in first thing. Once you come in, there's quite a bit of hanging around that you have to do, so you will go through some paperwork, you'll see a couple of nurses, they'll ask different questions. The surgical team and the anaesthetist will come in as well and have a conversation with James. And then it's just a case of a waiting game. You need to wait until your slot comes onto the theatre list.
Fine, I just need to do your obs.
This is going to be the fastest set of obs that's ever been done, isn't it?
And it's definitely boring by day 4 because there's less that you're not getting up to do as much, so you won't have an x-ray or anything to keep you preoccupied. Or
we're going to move the CPM machine and then we'll help you sit on the edge. And just make sure all your attachments are out of the way. So what I'll do is I'll just support your leg again, and then what we'll do, if you can bring yourself around. Yeah, you got it. Good. We are part of the physiotherapy team and we're here with James today. Obviously he's just recently had his surgery, and what we're doing today is just getting him sat on the edge of the bed, getting his knee moving, for him to start doing the exercises himself, and then obviously getting him up on his feet and trying to get him walking as normally as possible. And then it's just going to be working on getting him walking further and getting him more and more independent, eventually getting him onto his crutches, doing any stairs, anything like that, and obviously getting that knee bending as much as possible. Can you bend that foot and your knee at all? Right, so what we'll do is we'll start by having a stand up to the frame, just to make you feel a bit of stability. All right, so So you just push up from the bed with your hands. That's it. All right. Good. So eventually we want to get to the getting onto your heel, coming onto your toe, and then your toe off. But that will come. What we'll aim to do is we'll see James every day that he's here while he's an inpatient, and it will just be with an aim to getting him more and more mobile, more and more independent before he goes home. So has it just sort of been stopping, all right, randomly?
Yeah.
Okay.
So we've followed James through his operation. We've seen his early rehabilitation in hospital. Now we're going to take him for an x-ray to make sure the x-ray looks good and the bones are in the right place. Then we'll follow him as he goes home and starts his rehabilitation at home. So these are the post-op images of James, who we operated on. He's obviously still rehabilitating downstairs. He's on his CPM machine, and we've got these just to check. And I think they look pretty good, to be honest. You know, we've got rid of that large bumper bone. Here you can see on the pictures that we took in the operation that we got rid of that bumper bone. And on the side view, things look, you know, good as well. So
there's no step there now at all, is there?
No.
The bump is completely gone.
Completely gone. And now it's a question of just getting his range of movement back, getting his pain under control, and then working hard with the physios to go from there.
Looks good.
It wasn't as good a sleep last night. My knee started getting a bit sore about 2 o'clock. I didn't get sleep between about 2 and 4, and then I took some cocodamol tablets. You got to be careful not to itch the actual scar line. You got to get around the side. And also my knee's gone very yellow today. It's bruised right up.
Right, James, second day of being at home. Tell us a bit about your setup.
Well, obviously I can't go up and downstairs at the moment, so I've got my mattress downstairs in the lounge. Duvet, I've got the big TV on with Wimbledon on at the moment, so that's alright. Toilet downstairs as well. My parents get food for me, so I don't have to keep moving through to the kitchen, because the first few days your knee can be quite sore walking on crutches. You can't do... Oh my god, what was it?
5 days post-op, tell us about your knee.
I'm doing my second set of exercises for the day, so I'm getting my knee to more or less 90 degrees, and that causes the stitches to weep just a little bit, so I'm having my dressing changed probably in a couple of days. Today I'm going to have my last blood thinning injection. When you're over the age of 16, you've got to have one of these every day after you leave and while you're in the hospital. You've got to have it after for 10 days, and your parent will do it. They'll get shown how to do it by the ward staff before.
Okay.
Yeah.
Just a quick injection. Squeezing the tummy, putting the injection in and needle out. And it's a bit sore.
Yeah, it's a little bit sore. Right, dropped a bit on the rug. First trip to physio, the first thing we're doing is checking the knee bend and the knee straighten, so pushing my knee down into the bed, seeing the angle that my knee's at, and then bending up to I can reach about 80 degrees on the bed at the moment. My days at the moment, because I can't really get up and do anything, mostly consist of watching some TV and play some games like Uno when I get really fed up, and I've got an Xbox for a bit.
So we're now about 16 days after we operated on James. He's been discharged home, and he's very kindly agreed to speak to us over Skype. He's obviously been doing a diary so that we can be following his progress, and we're now going to catch up with him to work out exactly how he's getting on.
Excellent. Let's Skype him. Here he is. Hello.
Hello.
Hey James, how you doing? Should we go to camera?
Yeah, can you see us?
No, we can't see you.
No, can't see.
Click on the middle one. There we are.
There we go.
How you doing?
I'm alright, thanks. How are you?
Yeah, very well, very well. We just wanted to catch up with you, really. We obviously had a chat with your mum last night. Thank you very much indeed for the footage.